Hello friends, this is Dr. Rhythm and today let's talk about migraines. Now if you have been told that this is just a migraine, you can write this one out, this is wrong. Because migraines is not just a simple headache, in fact it's a complex headache which can last for up to 3 days, and during that time it can have significant impact on your daily routine. Migraine is also very common, and roughly 12 to 15% of North Americans will suffer from migraine or migraine-like headaches. A common migraine typically manifests as a sharp, throbbing or pulsating headache, usually on one side of your head, but it can also happen on both sides or also can be bilateral. It is also associated with feeling nauseous and can also be associated with increased sensitivity to light and sound. A normal episode of migraine can last for 4 to 72 hours. There's also other kind of migraine called classic migraine, which can have some warning signs, which is also called aura. These warning symptoms are mostly neurological, and they can manifest as vision problems, speech problems, sometimes problems with your balance, or also can manifest as one-sided paralysis. These symptoms are also often confused with as if you're having a stroke. These symptoms normally last for 5 minutes to 60 minutes, followed by a classic headache patterns. There are also various triggers which have been associated with migraine, and the most common is sleep deprivation, dehydration, stress, and certain foods, also including red wine. Migraine also tends to run in families, indicative of its genetic component. Now, when you're having an attack or episode of migraine, this is what I normally tell my patients what to do. So during the time of attack, it is very important you act quickly, because the more you're going to wait, the more you're going to try to toughen it out, the difficult it will be to control your headache. If possible, try to find a quiet and dark space. There is role of quick-acting pain medication or pharmacological agents which can be helpful in aborting an attack or episode of migraine. You can try over-the-counter medications such as rapid-acting Tylenol or acetaminophen, or rapid-acting ibuprofen, also known as Advil gel capsules. If this is not enough, then you can speak with your physician, who can prescribe you a slightly stronger-acting anti-inflammatory medication, which is, for example, Cambia, which is a powdered form of diclofenac. There's also a category of medication known as triptans, which can be used to abort an attack of migraine. These medications can be either taken orally, sublingually, and also intranasally, and if you end up going to the hospital, it can be also given as an injectable form. Now, if because of heart reasons you're not able to take triptans, then there's a new category of medication called CGRP receptor antagonist that can be used to abort an attack of migraine. If you're having more than 4 episodes of or attacks of migraine per month, then I normally advise my patients to discuss with your GP or neurologist regarding preventative measures. These preventative measures include taking daily medication. Sometimes you take an injectable form of medication every month, and in my practice I would also perform nerve blocks or Botox injection for prevention of migraines with good results. Again, lifestyle has a very important role. Stress management, sleep optimization, adequate hydration, and avoiding other food-related triggers can be helpful in preventing migraines. In the next section, I'm also going to discuss about some of the red flags for headaches that we should not miss. But for now, the take-home message for migraine is that it is not just a simple headache. It spreads like a wave. The key is to act quickly, otherwise the symptoms can persist for a longer period of time and can have an impact on your daily routine.